This is a talk that I gave at the Society for Research on Nicotine and Tobacco Europe conference in Oslo, Norway on the 12th of September 2019. So I'm going to spend the next 30 minutes or so talking about the EU Tobacco Products Directive as applied to e-cigarettes, outlining some of the regulations in that directive and the research surrounding it. So in order to explore what's worked, what the caveats are, and where there are areas for improvement. So these are my disclosures. And here's the overview. So I'm going to start by providing some background into e-cigarette regulation. I'll then outline the Tobacco Products Directive and Article 20 as it relates to electronic cigarettes and the regulations that make up that directive. I'll then look at some of the promises as well as the concerns that have been expressed around the directive before moving on to the research. I will look at some of the broad research on vapers' responses and experiences to the Tobacco Products Directive, the TPD, and then move on to look at the nicotine concentration upper limit in e-liquid and the nicotine warning messages on packs. So these are two areas where there's been the most amount of research, so that will be where I'm focused the most attention. Okay, so in terms of background, e-cigarettes appeared on the European market in around 2006, and as they gradually became more popular over the next 5 years or so, authorities began to consider how to regulate them. Nobody really knew how to deal with this new category. Should they be regarded as medicines or drug delivery devices? Are they tobacco products? Or perhaps they should be treated more as consumer products. So to give two examples of the uncertainty around regulation around that time, in the US in 2009, the FDA instructed the US Customs and Border Protection to reject the entry of a shipment of e-cigarettes into the US, stating that these were unapproved drug delivery devices. This was overturned in the court of law, and the FDA were informed that it can only regulate e-cigarettes as tobacco products, that is, unless therapeutic claims are made. Later then, in 2011, the FDA announced that it would regulate e-cigarettes as it currently regulates tobacco cigarettes. In the UK, following a consultation into e-cigarettes in 2010, the Medicines, Healthcare Products and Regulatory Agency, the MHRA, similarly announced its decision to regulate e-cigarettes as medicinal products. This was initially backed by the UK government in 2013. However, the European Parliament didn't back this proposal unless smoking cessation claims were made, and then discussions began in around 2012-2013 about including e-cigarettes as part of the next revision of the European Union Tobacco Products Directive, which was due to be updated in 2014. So this was an existing directive that was originally created in 2001, and as I say, it was due for a revision in 2014, so it seemed natural to include e-cigarettes under a separate section known as Article 20, where they'd be treated as consumer products but could be included within the revision to the TPD rather than creating new legislation for e-cigarettes. So the aim of the TPD is to improve the functioning of the internal market for tobacco and related products, whilst ensuring a high degree of health protection for European citizens. So the directive was adopted in April 2014 and came into force in May that year. And member states then had to transpose the TPD requirements into their national legislation by the 20th of May 2016. And most countries allowed a 1-year period for full compliance, that is, to allow manufacturers to sell off their non-TPD compliant stock. So, according to the European Commission, regulations around e-cigarettes were introduced in order to ensure minimum standards for the safety and quality of all e-cigarettes and refill containers, to ensure that information is provided to consumers so that they can make accurate and informed choices, and to create an environment that protects children from starting to use these products too. So what are the specific regulations that make up this directive? This is an infographic taken from the European Commission website. The left-hand side depicts the status quo prior to the introduction of the TPD, and the right-hand side then shows the changes. So in relation to safety and quality, the directive sets out a maximum nicotine concentration of 20 milligrams of nicotine per milliliter of liquid. It also stipulates a maximum capacity for the e-liquid refill containers, and the maximum capacity is at 10 millilitres. And in relation to the e-cigarette devices, there's a limit on the capacity of the e-liquid tanks or the reservoir, and at 2 millilitres. Nicotine-containing products and packaging also have to be child-resistant and tamper-proof, including a mechanism that allows refilling without spillage. And ingredients must be of high purity, with consistent delivery, with no additional forbidden ingredients. In relation to packaging and labelling, health warnings, either this product contains nicotine, which is a highly addictive substance, or the slightly longer version, which also includes it is not recommended for non-smokers, must cover at least 30% of the pack. These are mandatory on all e-cigarette products. The packaging must also include a list of ingredients contained in the product, information on the product's nicotine content, a leaflet on instructions for use, including information on adverse effects, at-risk groups, and addictiveness and toxicity. To continue, there's also a notification regime, which requires manufacturers to submit a detailed report before introducing new or modified products onto the market. And the directive sets out a monitoring and reporting requirements to ensure that there's a system for reporting and collecting information about adverse effects and safety concerns. And there are also advertising restrictions, including no advertising or promotion on e-cigarette packs, and no cross-border advertising either. Now, many of these regulations are open to interpretation, and there are indeed some differences in implementation across EU member states. So I've covered the background to the development of the Tobacco Products Directive and the promises. What about any possible concerns? So there are a number of concerns expressed around the time the directive was being implemented, and here are a list of some of these. So in relation to the notification regime, there were concerns expressed at the time that the cost and the burden of the notification process may force some smaller companies out of business. It might drive some products off the market or stifle innovation. In terms of the advertising and promotion restrictions, again, some consider this to be excessive in relation to the harms from vaping compared to the harms from smoking. And e-cigarette bans, advertising bans, moreover, can protect the cigarette trade from a less harmful challenger because e-cigarettes therefore become less available, less salient, less attractive. The restriction on the nicotine concentration with the maximum limit at 20 milligrams per milliliter has also been a subject of debate for some. It's possible that it reduces satisfaction and successful switching. This would particularly be the case for those smokers who are more highly dependent and who may need higher levels of nicotine in order to find the product satisfying and to successfully switch from smoking to vaping. It may also force vapers who need higher concentrations to lower their nicotine content, which might make them vulnerable to relapse, or force them to use lower nicotine concentrations and therefore they use more liquid, and just sends a misleading message that nicotine is harmful. The limits on the refill bottles and the limits on the tank capacity just generally mean more faff, more hassle for the user. More frequent refills are required because the tanks are smaller, which means users need to carry around spare bottles of liquid. This means there's more chance of spillage, more chance of running out, which could lead to smoking. It's also more costly, there's more environmental waste, and in fact it's unclear really why these restrictions are in place. Possibly this could be due to misunderstandings about nicotine toxicity. And then finally, concern has been expressed over the nicotine addiction warnings on the packs. And again, these may be excessive, both in size and content. They look like the warnings on cigarette packs, which is not commensurate with the risks. Moreover, there's question over whether these nicotine addiction warnings are actually accurate. Nicotine addiction depends on the speed and the manner in which it's delivered. And finally, it's possible it might also put smokers off switching to vaping if the nicotine addiction message on packs contributes to these perceptions that vaping is as harmful as smoking. So the overriding concern here is that the cumulative effect of all these restrictions, limits and warnings may decrease the number of smokers who successfully switch to a reduced risk product. And this idea that well-intended policies can have unintended consequences has been recognised. So, as highlighted in this statement from the Royal College of Physicians in 2016, which states that although a precautionary approach to regulation can be proposed as a means of minimising harm, it can also cause harm by perpetuating smoking if e-cigarettes become less available, less effective, or less acceptable. So let's turn next to look at whether any of these concerns have been borne out. So I'm going to turn next to have a look at the evidence. Starting with the notification process, well, this doesn't seem to have been a real problem in most countries, and this is testified by the number of notifications that have been received and accepted. So the number stands at over 40,000 in the UK, in France 37,000, and in Germany 137,000. However, the guidance that is provided for manufacturers to submit a notification, the notification fee, and the waiting time to market varies considerably across member states. So in the UK, for example, there's extensive guidance on the MHRA web pages, and there's very little waiting time. Poland, however, seems to be an example of a country where fees and waiting times are particularly high, and this could possibly advantage the larger companies and restrict product choice. And then finally, in terms of the notification process, in a small observational study of vape shop workers, Emma Ward and colleagues reported that those that were working in the sector had no major problems with the notification process. It was thought to be a little bit of a burden, but no real problems there. Okay, so what do vapers themselves have to say? So these data are from our e-cigarette trajectories study led by Caitlin Notley and Emma Ward at the University of East Anglia. We interviewed 162 vapers after the implementation of the TPD about their perceptions and experiences of it. So on the positive side, there was low awareness and low impact for many in the sample, although this low awareness could also be a negative, as some in the sample believed that e-cigarettes were currently uncontrolled and they wanted regulation that in fact already existed in the form of the TPD. The main advantage of the TPD regulations for many was the list of ingredients on e-cigarette bottles. Many of the users that we spoke to found this to be particularly reassuring. And also, none reported that the restriction on the e-liquid strength, the restriction at 20 milligrams per milliliter, had actually caused them to relapse to smoking. Although it was generally considered that the limit of 20 milligrams per millilitres was too low for many participants, and several commented that it may prevent smokers from converting to vaping, as they needed a nicotine concentration above this limit themselves to successfully switch. On the negative side, there were many comments about the limits on consumer choice. Vaping was generally considered to be more expensive and choices had become a bit more limited. Participants also noticed that vaping had become much more inconvenient. There were lots of comments about having to carry around extra bottles of e-liquid because of the small tank size, comments about how much of a pain it was having to fill up your tank every few hours. There were also reports of stockpiling ingredients, and particularly stockpiling the nicotine concentrate, which is used in home mixing, which of course goes against the TPD intention of improving safety. We don't really want people stockpiling lots of high concentration nicotine strength. And interestingly, a number of market reactions or loopholes were also mentioned. So in response to the 10 milliliter limits on nicotine refill bottles, e-liquid manufacturers have produced larger bottles of nicotine-free flavoured e-liquids to which nicotine shots can be added. So these are 18 milligram per milliliter nicotine-containing e-liquids, which are in TPD compliant bottles, which then can be added to the larger bottles of nicotine-free. And some companies have also introduced spare kits that can add capacity to tanks, which can be purchased separately. So there's just an example. In relation to the nicotine concentration limit, although this is a study that was conducted in the US, it's relevant here as young adults who were dual users were asked what they would do if regulations were introduced that limited the amount of nicotine in e-liquid. And they tended to report that in this case, that they would smoke more and that they would vape less, which of course is really not what we want to see. People using a more harmful product rather than a less harmful product because of a reduction in nicotine concentration. And in another study with 41 vapers who mixed their own e-liquids, again, getting around the TPD nicotine concentration restriction was mentioned as a common motivator for home mixing. Other examples were because it's fun, for reduced cost, and for quality control. And 85% of them actually expressed concern that the impending TPD changes would affect the availability of the 17 milligram nicotine concentration e-liquid, which is used for DIY mixing. And again, as in the Emma Ward study, a large number of participants said that they stockpiled the nicotine, higher nicotine concentration to add to their mixing. However, when we actually asked people about the nicotine concentrations that they were currently using, most were actually using concentrations far below the 20 milligram per milliliter TPD nicotine concentration cutoff. And this actually leads to an interesting observation that over time there seems to be a trend towards the use of lower nicotine concentration e-liquids. So people now tend to be starting on lower levels compared to the levels that people were using 5 or 6 years ago, where it was quite common to see people using 18, 24 and higher. But also over an individual's vaping history, there tends to be a decrease over time in the nicotine concentration that people are using. And although we haven't directly asked vapers why they've lowered their nicotine concentration, there are likely to be a variety of reasons for this. So firstly, the improved sophistication of devices over time. So over time, we've seen the development of more sophisticated, higher power devices, which allow better aerosolization of the liquid, which produces more vapor, so lower nicotine concentrations are needed along with this higher power. There may also be the concern over the addictiveness of nicotine. So if people are concerned about nicotine addiction, they tend to try and wean themselves off over time. And then finally, there's, of course, the reduced availability of the higher strength with the introduction of the TPD, especially in Europe. Okay, so continuing with the evidence here, in a lab-based study with 11 experienced vapers who were typically using a higher nicotine strength e-liquid, we explored the extent to which those who switched to a lower nicotine concentration e-liquid changed their patterns of vaping and what effect this might have. So we used 11 experienced vapers. They used a standard e-cigarette, the eVic Supreme, which has an inbuilt puff counter which allows us to capture detailed puffing information. And the vapers in this study came to the lab on 2 separate occasions, and they vaped ad libitum for 60 minutes. Under one condition, they used a low nicotine concentration e-liquid with 6 milligrams per milliliter, and on the other occasion, they used a high nicotine concentration of 24 milligrams per milliliter. And we found clear evidence of an attempt to self-titrate through compensatory puffing. So you can see with the low nicotine concentration shown in red here, our participants increased the number of puffs over a 1 hour puffing period. They also increased their mean puff duration, and this resulted in a doubling of e-liquid consumed from the high to the low condition. We were then able to use a vaping machine to generate the aerosols using the mean puffing patterns recorded in our participants under the high and the low nicotine concentration conditions. And we found that the puffing patterns associated with using the lower, the 6 milligram per milliliter nicotine e-liquid, resulted in a 52% increase in the amount of aerosol or vapor that was produced. And in turn, this led to an increase in a number of cancer-causing compounds such as formaldehyde and acetaldehyde. And the graph illustrates this on the right. So those data were gathered from a 1 hour vaping period in the lab, which of course may not be representative of how vapers use e-cigarettes in the real world. And vapers have told us that when they actually lower their nicotine concentration, they tend to adjust the power. So in this CR UK funded study, we aim to explore this further in a real world setting. We used a broader range of flavours, and we allowed participants to alter the power of their device in some conditions. So we had 20 exclusive e-cigarette users. We used the same e-cigarette device, which allowed us to capture puffing patterns, and our participants underwent a 4-week period where they used a particular nicotine concentration over a whole week's period. So they either used a low nicotine concentration or a high nicotine concentration, and on some occasions the power was fixed, and on other occasions participants were allowed to adjust their power as they saw fit. They had a choice of flavours, although they had to stick to the same flavour for the 4-week period. And then at the end of each week, we collected puffing information from the e-cigarette device. We also collected urine so we could look at some biomarkers of toxicant exposure. And we asked about their mood and physical symptoms, their urge to vape, and positive and negative effects as well. And again, as in the previous study, we also used a vaping machine to generate aerosol based on the puffing patterns, this time of each participant under each of the 4 conditions. And we then captured the carbonyl compounds in the aerosol so we could measure the amount. So here are our results. So in terms of power, when participants were allowed to change the power, they tended to increase it. But they did this to a significantly greater extent when they were using the low nicotine concentration e-liquid. As in our lab study, we also found with the lower nicotine concentration that our participants tended to puff more, and also they took longer puffs. And this was especially true when power was fixed. However, even though they changed their puffing patterns and puffed more intensively, their urge to vape was significantly higher and their satisfaction was lower when they were using the low nicotine concentration. And when we looked at biomarkers in urine, although we found no difference for acrolein, we did find higher levels of formate, a biomarker for the carcinogen formaldehyde, in the low nicotine condition, particularly when power was adjusted. And this was reflected when we looked at the carbonyl compounds in aerosol as well. Again, we saw greater exposure to formaldehyde and acetaldehyde in the low nicotine condition. And in our cancer risk simulation, our simulations suggest there's a 1.27 to a 2.06-fold increase in cancer risk when switching from the higher, the 18 milligram, to the 6 milligram per milliliter nicotine concentration e-liquid. Now, those last two findings are still under review at this time in scientific reports. So this is one area where there may be unintended consequences of policy. So use of a lower nicotine concentration e-liquid results in compensatory behavior, which can increase craving, reduce satisfaction, and increase exposure to cancer-causing toxins. So it may therefore be safer to use e-liquids with a higher rather than a lower nicotine concentration, and limiting nicotine concentrations in e-liquid as per the TPD regulations may in fact do more harm than good. Now, just to balance this a little bit, I think we also need to be mindful of any possible effects in non-smokers. So if there's any evidence that limiting nicotine concentrations might deter uptake and continued use in non-smokers, then obviously this may be a good thing, and we need to balance that evidence. Okay, I'd like to move on next to look at the e-cigarette nicotine addiction warnings. So the concern here is that the warning may be excessive in both size and content. So it looks very much like warnings on cigarette packs, which perhaps isn't consistent with the risks of vaping. So does this send the wrong message and scare smokers away from using e-cigarettes? So public perceptions of e-cigarettes are already moving in the wrong direction in many countries, with an increasing number of people thinking that e-cigarettes are as harmful or even more harmful than smoking. And there are also widespread misperceptions around nicotine, with up to 60% of participants in a recent study believing that nicotine is the component in cigarette smoke that causes cancer. So such concerns may be exacerbated by warnings such as these. One of the aims of the TPD is to provide accurate information to consumers so that they can make informed choices. And you could also argue that this information is not accurate. Although nicotine may be a highly addictive substance when delivered via cigarette smoking, it certainly isn't highly addictive when delivered in other forms, such as through the use of nicotine patches or gum, perhaps. And the limited evidence that we have suggests vaping is not as addictive as smoking either. So concerns about addiction are very, very apparent amongst smokers. In both the ASH 2017 and the 2018 surveys, not wanting to substitute one addiction for another was the main reason given for not trying an e-cigarette. So, is there any evidence that these messages may increase concerns about vaping amongst smokers and put them off using a product that's much less harmful than smoking? Well, in a recent publication by Van Murik et al., a small but significant increase was reported in perceptions of addictiveness and toxicity in smokers and vapers between 2015, when these warning labels were not present, to 2017, after they had been introduced on e-cigarette packs. So how else could we present information about the relative harms of vaping versus smoking in order to encourage smokers to use, but not to attract non-smokers? So we've worked with experts in the field to develop a set of alternative messages that could be used on cigarette packs. We're in the process of validating these. We've engaged with experts to help develop these. Currently, we're writing this up for publication, but these will be a useful tool for other researchers who want to look at any possible effects of relative risk messages versus some of the existing messages. So we've used these in a couple of studies so far. So first of all, in a small study at LSBU, we explored the effects of the TPD nicotine addiction warning compared with the 95% safer message and compared to a no message condition in an online survey of 95 smokers. We found that willingness to use, likelihood of purchase, and intentions to use an e-cigarette and a quit aid were all lower after viewing the TPD message. So this is before viewing the message, and red is after viewing the message. And you can see these decrease after viewing the TPD message, although they didn't differ after viewing the 95% safer message or a no message condition. Now, that study was in a small sample of smokers, and the messages were not displayed on the e-cigarette packs themselves as potential users would normally view them. So in a more recent CR UK funded study, 2,495 participants, both smokers and non-smokers, self-reported their e-cigarettes, their perceptions of e-cigarette harms, as well as addictiveness, effectiveness, intentions to use, intentions to purchase, and so on, before and after exposure to e-cigarette packs, which contained either the TPD message, a reduced risk message, this product is much less harmful than smoking, or they saw both messages together, or they saw packs with no messages. And we used a variety of different stimuli, not just this e-cigarette pack. We used other packs as well, but participants just saw one of these messages or no message. We also used the longer TPD message as well, but findings didn't differ across those two messages, so I won't go into that any further. So these findings haven't yet been published. The paper's currently under review, so we hope that these will be publicly available soon. But to just go through the main findings, harm and addictiveness perceptions were higher after viewing e-cigarette packs that displayed the TPD message compared to viewing e-cigarette packs that contained the reduced risk message. When comparing the TPD message versus no message, the increase in harm perceptions was seen in non-smokers only, so we didn't see an effect of TPD in smokers, which is actually in contrast to our previous study and in contrast to the findings from the Van Morik study. So it could be argued that for non-smokers, the TPD may be performing as intended, sending non-smokers the message that e-cigarettes are potentially harmful, which could potentially then act as an effective prevention tool. When comparing the reduced risk message presented alone to no message, there was a reduction in harm perceptions, but this was seen in smokers only. So seeing this reduced risk message didn't make non-smokers perceive e-cigarettes as any less harmful. And the reduced risk message compared to the TPD message increased purchase intentions and usage intentions in smokers, but not in non-smokers. So overall, it seems that a reduced risk message, such as this one, may potentially act as an effective harm reduction tool for smokers in the sense that it reduces their harm perceptions and increases purchase and use intentions, but without resulting in an increased uptake amongst non-smokers because their usage intentions didn't increase. Okay, so to conclude, overall, the full effects of the Tobacco Products Directive are still not clear, and there hasn't been a great deal of research. But I think based on what we do know, we can say that there are some positives and some unintended consequences. So the positives, the notification and monitoring regime, this seems to have worked fairly smoothly, particularly in the UK. And some aspects of the regulation, particularly the ingredients list, seem to be particularly reassuring to consumers. So that's a good thing. The unintended consequences, the restrictions on tanks and the e-liquid refill size, vapers do report that this has become much more inconvenient. And also, of course, there's more waste. It can also deter smokers from vaping because it just makes vaping more of a hassle. It's also unclear what underlying evidence there is to support these restrictions on tank sizes and liquid refill bottles. In terms of the limit on nicotine concentrations, there's no evidence that this has resulted in vapers relapse into smoking, but it may contribute to making vaping a less satisfying alternative to smokers. And more importantly, we've demonstrated that it can result in compensatory puffing, meaning that more e-liquid is consumed. This obviously comes with a financial cost and also, as we've demonstrated, with a potential health cost. And finally, in relation to the e-cigarette warning labels, reduced risk messages can reduce harm perceptions and increase the likelihood of use in smokers without the unintended consequences in non-smokers. And there's some evidence that the TPD message itself may perpetuate concerns regarding e-cigarette harms. So the ugly truth, that is that smoking kills about 8 million people a year, and vaping is much less harmful. Any regulations that make vaping more inconvenient, less satisfying, or which increase perceptions of harm or addiction can increase harm through continued smoking. So I think we need to finish by reflecting on what the purpose of regulation is. What is it that we're trying to achieve? The promises of the TPD were to ensure safety and quality, a high level of health protection, to provide accurate information, and to protect children. At this stage, the extent to which these promises have been fulfilled, I think, remain unclear. And if they have, I think we also need to reflect on at what cost, if any, to smokers.